Hi, everyone. I'm Jennifer Rakes. I'm the Executive Director of the TLC Foundation for Body-Focused Repetitive Behaviors. And since you're here, I'm guessing you probably know that. I'm really thrilled that you're all joining us for this very special free webinar with Sharene Azimi of Mission Communications. What I'm most thrilled about is that your attendance indicates your great interest in helping us spread the word about BFRBs and to educate the public and your local communities. And so I'm excited to be able to share Sharene's expertise in working with the media and in writing for the local papers and magazines with you. And I'm looking forward to probably learning a few things too. So today's webinar will last about an hour, and unfortunately, because of the format of the webinar and the attendance, we can't hear you or see you. You can hear us and see us, but we can't hear and see you. So the way that it will work is you will listen, and we will leave about 15 minutes at the end for questions. The way to ask questions is to type them in. So on your control panel for the GoToWebinar control panel, towards the bottom there is a tab that says questions. If you click that so that it opens, it's a place that you can type in questions, and I will be able to see them, and I will read them to Sharene at the end of our webinar, so that we're able to get your questions answered. Please feel free to type in questions at any point in the talk as they occur to you. But we'll probably, unless something is really urgent, like there's clearly something that's not being understood, unless it's urgent, we'll save questions for the end. Meanwhile, I'm just really thrilled to have Sharene here with us. Sharene's been working with TLC now for, goodness, about 5 years already? Is it that long?
Maybe 4, yeah.
5 years, yeah. And has really been super helpful in helping us organize our strategic plan in the big rebranding that TLC did when we changed our name a few years ago. She has a degree, a master's in journalism from the Columbia School of Journalism. She's worked for 25 years doing, helping nonprofits to strategize and communicate and work with the media. She has a real passion for nonprofit work, and I am thrilled that she's been helping us. And thank you, Sharene, for speaking with us today, and I will let you take over.
Great. Thank you, Jen. Yeah, I'm wondering if maybe I've met some of you. I've been at the last few BFRB conferences and did a presentation at the last one about communication. So hopefully some of us have connected before. And if not, do feel free after this webinar to be in touch with TLC and let us know if you're interested in doing more writing, and they can always loop me in to help with any particular projects. So what we're going to talk about today is focused on helping you write an opinion essay with the goal really of getting something in your local paper. The idea is that, look, you do have to be an expert, generally speaking, to write for something like the New York Times or LA Times opinion pages. You don't have to be an expert in the technical sense to write an opinion piece for your local paper. And in fact, your experience of either having BFRB or being a practitioner and treating them, or being a family member or an educator, gives you sufficient credibility to speak and write on the topic. So that's what we're really going for, is we really want to empower you to take your personal story, take your sort of individual expertise as someone who is part of this community, and then share that with your larger region, really. And certainly if you have the confidence and the opportunity to go for a broader audience in terms of your publishing outlet, then we applaud that as well. So that's what we're going to be doing. Okay. Let me just click over here. I don't need to see that. Okay. So our goal today is really just to instruct you in how to prepare and submit an opinion piece. This is very how-to oriented. What we're going to do first is present to you the messaging that we've been using. This is some language that we developed a few years ago as part of the rebranding effort, when we really had to move from kind of just talking about TLC as being a group primarily for support of trichotillomania to being an organization that supports the entire BFRB community and also is conducting some very high-level research. So we're going to talk to you about those messages. We're going to talk about options that you have for kind of presenting your own connection with the cause. And then we're going to give you like very specific tips for writing letters to the editor, which is one thing, and opinion pieces, which is another thing. Okay, so here's the messages that we've been using. Hair pulling, skin picking, and other body-focused repetitive behaviors. And that's the way we write it, the little hyphen, and then we usually abbreviate it the first time that we introduce it. But these are part of a category of disorders affecting about 3% or more of the population. That's a figure that we feel comfortable using, yet it's still underdiagnosed and insufficiently treated. So the thing about a message is you don't have to worry about using our language verbatim. What you're really trying to do is just kind of get this in your head that this is a way that we want to kind of just present the issue overall. Part of the reason we're doing this is that for many years, as you know, BFRBs, first of all, it wasn't understood that these different things were related, hair pulling, skin picking, cheek biting, whatnot. Also, they've often been considered, you know, a nasty habit or kind of something like an OCD. So we want to make sure that we explain that there is a diagnosis now, and these things are related. The next thing we want to understand is that this is the problem. You know, why is it significant? Well, it's significant because these disorders can cause pain. They can cause people to become socially isolated. They can even lead to some visual disfigurement. And yet, a lot of people don't sort of come out about it. They suffer for years in silence, either because they don't even know that their problem has a clinical diagnosis, or they don't think that there's any effective treatment for them. The other reason this is really significant is because part of what keeps people back from seeking treatment and being out about it is this sense of shame, due to the misperception that it's simply a bad habit that people can stop. And as you all know, without any kind of intervention, stopping is almost impossible. So this is kind of how we want to frame the problem, because if people think of it as, oh, you know, someone twirls their hair, they pick out some hair, no big deal. But if they understand that it's not necessarily something that you want to be doing, that it's causing you some shame, that it's perhaps making it hard for you to connect with people and even resulting in some physical problems, and it magnifies and further explains the scope of the problem. Okay, the next kind of key message is, well, what are we doing about it? And this is what TLC is doing about it. We have been positioning TLC as the world's leading authority, which it really is, on these disorders that, again, affect a significant portion of the population. I think we've said more than that suffers from things like anorexia nervosa, even more, I believe, than suffer from sort of traditional OCD. We like to make it very clear up front that we do have a scientific advisory board. These are the foremost clinical and research professionals in the fields. I mean, they really are. It's not just a thing we say. These are really the people on the cutting edge of research into this field and also into treatment in terms of their psychiatric and psychology practices. And so we as an organization are really trying to take a comprehensive approach to helping people heal and overcome their disorder. And there are 4 ways that we do that. And again, you don't have to memorize all these, but we just want to make sure that everyone who's kind of out there talking about the issue is aware of the resources that can help people, you know, advance toward a solution. Okay, so the 4 main ways are: 1, connecting affected individuals and families. And as you all know, TLC does a great job of that. We've got the conference, they've got the newsletter, they've got the website, they help facilitate support groups. 2 is to refer people to appropriate treatment providers, services, and resources. And most of this is available for free on the website, right? You can go onto the directory, you can find a therapist in your area who has been trained in cognitive behavioral therapy that's thought to help. You can go online and even find like hairstylists who are kind of familiar with and sympathetic to the issue. So that's the second thing. The third thing is that we do actually, TLC does actually conduct outreach to healthcare providers. You know, they provide their professional training institute. They do that a couple times a year usually, and it's like a 3-day intensive program. So the idea that there is training available to learn more. And then finally, but not least, is designing and funding research projects. And again, you don't have to know everything about the Precision Medicine Initiative, but I have found, you know, in dealing with journalists, when you talk about funding research, you talk about the largest ever patient study of people with BFRBs, getting into the genetics and, you know, what the underlying neurological issues may be. People kind of perk up their ears that suddenly it seems very much not just a habit and very much, you know, a serious medical condition. So we just want you to be familiar with how we're presenting what TLC is and what TLC does. Now, whenever you write an opinion piece, usually your purpose is to get people to engage with the issue in some way, right? The very least to care, to learn something, and maybe even to do something. So if you're speaking, you know, in your outreach to affected individuals and their families, such as yourselves, you know, your call to action is kind of to join the community, right? Come and find support and resources to help you take charge of your recovery. So certainly if you had like a speaking engagement at a school or with a local group of, you know, psychologists or something like that, you know, the message is kind of come and join us. But if you're speaking to, you know, to your doctor, to pediatricians, to psychiatrists, psychologists, the call to action might be more, you know, you can really educate yourselves and learn more in how to identify and treat these conditions, how to help your patients. So that's a second potential call to action. What you're probably going to be doing with your op-ed is a more general audience. You don't know who's going to read it, right? It could be your neighbor, could be the guy on the bus. So what you want people to do is really just to kind of be sympathetic and support our efforts to make BFRBs a well understood and effectively treated family of disorders. The goal being that people can, you know, get rid of that shame, find the appropriate intervention for them, and achieve remission. So in that sense, a lot of other conditions and diseases have people who have come forward and been very outspoken and gotten others to also support them, even if it doesn't affect them personally. I think it's been hard to do that for this community, largely because of the shame. I think that if you are dealing with something like a breast cancer, frankly, you know, even something like a Tourette's syndrome, where I think it's understood that people can't help it, then it somehow makes it easier for people to kind of get on board. I think we need to overcome that shame and make this a condition that is as well understood and as well empathized with as any of these other conditions that affect so many people. So that's really the goal here, is to speak to that audience and people go, oh, I didn't realize that was really a thing, or oh, yeah, I think one of the kids in my class did that, or oh, you know, my sister-in-law does that, but I wasn't sure it had a name. So there are a lot of people out there who have some vague notion, and what we can do is educate them. Okay, so how do we do that? What's your personal connection to the call? Now, I don't know, there are 20 people on this call. I don't know what prompted each one of you individually to join today, but what I want you to leave with is the sense that wherever you are in the community, you know, you have a role to play, and also those that are connected to you do as well. So obviously, if you are someone who has trich or skin picking disorder, you're going to have your own personal story, and it's going to be powerful. But maybe you are a family member. A parent often has a very powerful story to tell. We just saw a wonderful essay by a sibling that we just put on the blog we set up on Psychology Today's website, talking about how growing up, she would see her sister engage in this behavior and how it was, troubling for the whole family, and sort of the progress that her sister made, and how she as a sibling wants everyone to understand what's going on. So that can work really well. Similarly, a spouse, partner, husband, wife, girlfriend, boyfriend, etc. The other people who can share stories are teachers, nurses, educators. So, maybe you write a piece, maybe you don't, but maybe you're close with a teacher at the school, or the principal, or the nurse, or the school psychologist, and you're able to suggest to them that they contribute a piece as well. As I think it mentioned in the marketing for this webinar, BFRB Awareness Week is every year the first week of October. Wouldn't it be great if not only everyone on this call wrote a piece, but if everyone on this call also got sort of a third-party messenger to write a piece? I would love to see my Google alerts like sparking up that week with personal essays all over the country. That's my dream. Other people that can write pieces and have a lot of credibility are, physicians, pediatricians, your dermatologist. Maybe you see someone who's been really helpful with your skin picking disorder. Maybe that person would actually like to write a piece about all the different people that they've seen over the years with this issue and what they've done to help them. I've never seen a piece like that. I would love to see that. Similarly, a psychotherapist. At the conference, we had a couple of therapist and patient sort of partners that came together to the conference so that the therapist could learn more clinically and the patient could feel supported through the community. So I'd love to see something like that, maybe even co-authored. And like I said before, hairstylist, massage therapist, someone who you may have found in your area who is somewhat knowledgeable and sympathetic. I'd love to see a piece from someone kind of on the margins of the community, but who's still a very sort of qualified observer. So those are kind of the perspectives that we can come at this from. Now, when we are addressing the public, like we said, we're going to go back to that general message of come, support our efforts. We want to make this well understood. We want to make it more effectively treated. We want people to not feel shame around this. So that's kind of your orientation. Now, to get people to care, you have to, what I call, engender empathy. Statistics don't really engender empathy. It has to kind of hit home. So when we talk about 3% or more of the population, that's about 1 in 30 people. And what I often say is that's probably about 1 kid in every middle school classroom, which is when the disorder usually kind of kicks in and becomes more problematic. So number one, we're talking about a significant portion of the population, and it's hitting kids young. The second thing I think we can really get across is that people engaging in these repetitive behaviors usually want to stop but can't, or want to reduce it but can't. So it's not a habit, and that's a big misperception that we need to get over. In fact, there are clinical discussions about when is something a habit and when is it a BFRB, and there are distinctions. The other idea, I think, and a misperception that we can get across is that this is not the same as self-harm, which is not to say that people should not have empathy for people who cut themselves or things like that, but the idea that when people are engaging in this behavior, it may be that it feels good, it may be relieving anxiety, it may feel almost like a more positive thing, but when taken too far, it can actually result in an unhealthy or unsightly condition. I mean, you can end up with infections, you can end up with bald patches, as you all well know. So I think on the one hand, we want to make it clear that significant harm can result, but that's not really the goal, that this is kind of a sort of separate entity here, a separate category. And the other thing I think that we need to drive home in order to engender that empathy is the fact that many people are hiding. I mean, I'm very happy that there are so many people on this call. We did one about this time last year, and we had maybe half a dozen or so people. I'd like to think that times are changing. I'd like to think that more people are willing to be outspoken on this topic. But I think to people's question of, oh, I didn't really think it was that big a deal, to explain that many, if not most people, hide their symptoms, and that this lack of acceptance really just compounds the problem. Okay, so now we're going to talk about specifically writing letters to the editor, and then we're going to talk specifically about writing opinion pieces. And I'm used to a more interactive format, so it's like I want to like throw out questions to you, but we'll wait till the end and then we'll take questions from you. So please do feel free to be making notes. I would like to encourage all of you to think about like an angle that you might use, a topic. And, you know, even if there isn't time on this call to get to that, start thinking about, well, what would my perspective be? You know, how am I identifying myself, right? As part of those roles in the community. Am I identifying as sort of a sufferer, a patient, as a family member, as a provider of some sort, as you know, a therapist? So think about what your role is and think about what your angle might be if you were to write something for that first week in October, because there's time. And just start to think about kind of what the hook or the topic might be. Okay. All right. So when and why do you write a letter to the editor? First of all, a letter to the editor is always written in response to a particular piece in that newspaper, magazine, blog, etc. Okay, so it is going to be about a BFRB or a very closely related topic. And it's going to be right in the first day or two after you see that, or you hear it on the radio, or you see it on TV. Okay, so right away you're going to write. Your goal in doing that is to either correct an error, which is often the case, or to kind of fill in an omission, something that they left out. And I would say the omission is where you might be able to get away with it not being exactly about BFRBs. Maybe they kind of talked around it but didn't identify it, and you need to kind of write in and clarify that, you know, they kind of missed something big here. The other thing you can do with the piece is to express gratitude. I mean, for gosh sakes, if your local paper actually devotes ink to, you know, let's say a feature story about, you know, third graders who've done something about BFRBs, write in, you know, thank them for their coverage, and use that opportunity to connect readers to the foundation. We do get a lot of traffic on the website, but we also know that a lot of people haven't found it yet. So a letter to the editor is a really nice way to kind of sneak in a link to resources for people. The other thing you can do with the letter is to let people know if you do have a local support group, and let's say there's an article that talks about TRIC, maybe it's local, maybe it's picking up on a national story, you can say, hey, we just want everyone to know that we do have a group and it meets such and such time and day. So it's a narrow window. You have to kind of seize the moment. But newspapers do publish these every single day. So it's a great potential opportunity. When you decide you want to write a letter, usually the newspaper or the outlet will have some guidelines. These days it's usually on the website. Old days it used to be like on the masthead kind of the newspaper. But generally speaking, they will tell you how to do it and what the length should be. It's short. We're talking like 150 to 250 words. So that's like, you know, one page, less than one page typed. It's like a good, you know, paragraph. It's a good idea to always scan the other letters in that publication to see what they publish. Generally speaking, they will edit them. So it's a good idea to kind of see how they're formatting them. When you put the letter together, you have to reference that particular article that you're responding to, the title and the date of it. They have to know what it's in response to. And your goal in this paragraph or so should really just be to make one point. You know, one big correction, one big thing they missed, one big thing you think the local community should know. a big misperception that needs to be changed, a call to action of some big upcoming event, perhaps you're having a rally or something. Really one big thing, and then make sure that in that letter you've explained what your relationship, what your role in the community is, so that people see you as a voice of authority. Now, you're going to draft it, and then you're going to go back and you're going to edit out any unnecessary words. Think that they are going to edit it for you. So what can you afford to lose, and try to boil it down so that they have as little editing to do as possible. Okay, you're going to make sure there's no acronyms that you have not spelled out. You're going to make sure you're not using any jargon, kind of insider language. This has to be completely understandable to someone who knows absolutely nothing about this topic. Okay. In order to be published, you must include your full name, first and last, the city where you reside, and a phone number where they can reach you. Unfortunately, most outlets will not publish a letter anonymously. So if you're not ready to have your name out there, hold off. Your name must appear. Then usually these days, all you have to do is cut and paste that letter into the body of an email. In the subject line, you're going to reference the article, right, or kind of a shortened version of the title, so they understand what it's in reference to. And I would take the opportunity down in the body of the letter to make sure you've included a link to BFRB.org. It might be in like a little one sentence about you, that you're an ambassador with the TLC Foundation if you are, or if you're on a task force, or that, you're for more information and resources people can visit. But I would try to kind of sneak it in there kind of at the bottom of the letter itself. On the question of whether you would call to follow up, I mean, you can. I don't think it would do much good. I recommend that more with opinion pieces where there's like a little more lag time. But certainly, if you've written a couple of letters to the editor and you haven't gotten a response, I wouldn't say don't call. I mean, it certainly can't hurt, especially if they're allowing mistakes to stand. I mean, I think if they're allowing mistakes to stand, I would definitely call. If it's just that, you're trying to kind of get a plug-in, then, fine. They may not have felt it was super critical. But if you feel it's critical and they're not covering it, it doesn't hurt to call the editor and just see, why, or if they're planning on doing any kind of follow-up. Okay, now op-eds, my favorite. So I end up writing op-eds for clients. I don't get the credit, they do. You get the credit, you get to write your own op-ed and see your name in print if it gets published. So this is a great format, and it's the kind of thing that people like to share on social media, they like to email to their grandmothers. So I really encourage you to think about what you might want to write about for either for BFRB Awareness Week, or we're going to talk about some other kind of moments in time. Okay, so when can you do it? So if you were going to do it for October 1st, you would want to have it ready at least 2 to 3 weeks before, because editors are making decisions on op-eds in advance, unless it's like related to breaking news, like, a war or something. It should be, it can also be at any particular moment in time when there's been a lot of news coverage. So if you remember last year, maybe it was earlier this year, there was that young woman in the United Kingdom who had the so-called Rapunzel syndrome. She had trick, but she also ate it, caused this hairball, caused an infection in her stomach, she died. Well, that piece got picked up everywhere. And I would have liked to see more individual members of the community writing in and saying, hey, what happened last week was tragic. And, that may be an extreme case, but so many people are suffering in the shadows. And here's what we can do about it. Here are the resources that are available. So if there is something, out there in a magazine, in a newspaper, on TV, that touches on BFRBs in some way, that can be your moment in time to write a letter to your local newspaper, regional newspaper. Another time is to we think of this as sort of the editorial calendar. What happens during the year when this might be more or less relevant? So for example, I believe there is a mental health awareness month, I think. I'd have to look up when that is, sponsored by one of the big national groups. So you can use that as a hook whenever that is happening. But other times might be back to school. Let's say you have a 10-year-old, and your 10-year-old over the summer has been really exhibiting more symptoms of hair pulling, and now she's going to go back to, you know, 3rd grade or whatever. And is she going to talk about it? Is she going to tell her friends about it? Maybe it's making her more anxious and she's pulling more. Another time might be the winter holidays. We all see articles all the time about how Christmas time can be so, you know, stressful for some, depressing for others. Well, that is the case. And for people who pull their hair or pick at their skin or chew on their nails, that might just exacerbate the issue. So that could be a moment to write an opinion piece, you know, home for the holidays and in hiding or whatever. Another opportunity, which gets at sort of a different specific age group, is graduating from college or going on a job hunt. So that moment when you go maybe from the kind of accepted community of your university, or leaving a job where you've been very comfortable with people, going into a new environment, a new professional environment. Do you tell? Do you not tell? What do you do? Do you show, not show? I think that could make for a very interesting piece. And another one is about kids and summer and things like summer camp. So we had a piece on one of our other blogs that we set up on Psychology Today. One is kind of the personal perspective, and that's hosted by Jen Rakes. That's where we had the sibling essay. The other one is a clinical perspective, and it's hosted by Dr. Tara Paris, who heads up the Precision Medicine Initiative. We had a guest blog on that site by a psychotherapist who works with kids, and it was basically saying, you know, for summer, for some kids may not be so much fun, because if you have picked your arms, you might not want to wear short sleeves. If you're used to wearing a wig, you might not want to jump in the pool, right? So I would think it would be very interesting to see a piece that's specifically about young people and how they deal with, you know, going off to camp, going off to a new school, being in situations where, you know, they're not as clothed, not able to cover up as much. So these are just ideas. You can think of your own, but you do want to time it to something. Now, how do you get started? Okay, the first thing is, again, the outlet will likely provide submission guidelines, usually on their website, or if it's a print outlet, somewhere in the fine print where they list the who's who. Generally speaking, an op-ed is not going to ever be more than 1,000 words. Usually around 700 to 800 is a good goal. You should definitely take the time to see what they publish, just how strong they are, who's writing them, how expert the writers are. You know, are they taking kind of voices of the community? Are they relying more on, you know, credentials? See what they're doing with their op-ed page, and then hook it to some kind of an event in the news cycle. So if you've decided to write for BFRB Awareness Week, mention that. If you're writing because the winter holidays are coming and people are kind of getting out of sorts, mention that. Make it clear what they would why they would publish it then. Do outline it. I think it helps most people. I mean, if you're a fantastic writer and you love writing, you may not need to. I find it helpful to kind of think about what do I want to say? What are those kind of 3 key points that I want to make, and kind of how's it going to flow? And then I kind of fill it in. And then it's nice to end with a call to action, whether it is to just learn more, or to raise money or to educate people in your, educate others, or to, follow the research that's happening. So think about what people could do to feel or get engaged. It could even just be to, kind of talk to someone who you think is going through this and be sympathetic. Some more things you can do as you're writing this. I almost always spend the most time on my first paragraph. It is absolutely essential to not only get the editor's attention, but to make it clear what you're talking about right away in that first paragraph. You're not a known commodity, so you can't really get away with like lots of anecdotes and storytelling. You kind of just need to get right to the point of why you're writing, what you're writing about, and why you're qualified. I do encourage people to be themselves. So if using humor feels comfortable to you, then use it. If sharing brief anecdotes and storytelling is your style, that's great. If you are emotional about this and you feel that you can share it in a way that's not like too much, feel free to infuse some emotion. So you do want it to have personality and tone. You just don't want it to seem too extreme, and certainly never desperate. Each paragraph should be pretty short. Each paragraph makes a point. Again, you're making about 3 points. You can definitely incorporate some facts. This is not a research piece, but you can incorporate some, factual information. You can use what I call social math, so that instead of saying, like we said, 3%, you can say that's 1 in 30. That's probably a kid in every middle school classroom. Helps people visualize it. And here's the thing, you cannot overly promote any groups that you're involved with. The editor will see it as you trying to get free publicity. So while you can certainly link to BFRB.org as a resource, mention TLC as a resource, if you have a support group, you can definitely mention that. If you have an event coming up, you can mention that. But this is not about TLC. It's not about your local support group. It's really about the issues. So just remember to kind of keep that to a minimum. Then before you submit it, I encourage you to ask someone to edit your draft. They don't have to be an editor, but just get a fresh perspective. Make sure you include a brief bio that says why you personally are qualified to write this. Like we said, whether it's because you experience it, because you deal with kids who experience it, you deal with patients, etc. And then again, as with the letter to the editor, you do have to include your name, how they can reach you, and where you live. Again, usually they're not going to publish it anonymously. Then these days, it's really easy. We used to have to mail everything or fax it. Now you can just copy and paste it into the text of an email. The website of the newspaper will likely provide you with an email. Sometimes they have a form. If they have a form, use that. You're going to include a very topical subject line. You're going to make it clear what you're writing about, why now, and try to include a reference to TLC's website so that people can see that, again, it's a real thing. There's real science behind this. Okay, so Jen, I think we are just about ready to take questions. What I want to mention are some other kind of opportunities coming up. So one thing is that, like I mentioned, we do have this blog now on Psychology Today. In order to write for it, it helps if you have written or published somewhere else, just so we can have a sense of your writing style. So sometimes people have written a piece in another outlet and they kind of want to adapt or build on that. And if you're in that situation and you want to share that with us, we would be happy to look at that. The other thing that we've talked about with Jen Rakes and with Leslie Lee, the communications manager at TLC, is that for people who have a really strong voice and a strong idea and want to put together an op-ed, if you've taken this webinar and you need a little follow-up support, do email Leslie. She'll be the sort of first line of support, and if she thinks that it's something that I could help you with, she may be able to connect us. So I can't be editing a million pieces, but if you just need a little guidance, and maybe you want to share an outline or a topic, we may even be able to pull together like a go-to meeting for a few people and do a little workshop. So we kind of need to know from you what help you need in order to provide it. And certainly if we can get some things out there for the first week in October in different locations, I think it could be very helpful. Okay, so Jen, do we have questions?
We don't yet, so let me remind people how to submit questions if you have any. The way to do it is to type them in. You have a control panel from GoToWebinar, and towards the bottom there is a line that says questions. If you click on the triangle there to open that up, it gives you a space to type your question and send it, and then I will be able to read it. So we'll give you a moment or two to see if some questions come in. Let's see. No, okay, so far, no. So maybe Sharene was very, very clear. That's great. Oh, here we go. Okay, we do have one, and here we go. All right, let's see. So Karen is asking, when you talk about recent coverage, do you mean in the publication you're writing to, or just sort of generally?
Right. So for an op-ed, so for a letter to the editor, it needs to be in that particular piece that's what you're responding to. But for an opinion piece, no. So like in the case of the young woman with Rapunzel syndrome, maybe you saw it on Fox News, and you saw that it had gotten picked up, across the country, and so maybe you wanted to write to your local paper to say, millions of people around the world have become aware of this issue this week, but there's actually, a much quieter story right here at home. So you just use it as a hook, and then you kind of get into your more local personal story.
That makes sense. Roberta's asking something that I should have mentioned at the start of this, asking if we can get a copy of this presentation, and the answer is yes. This presentation has been recorded, and we will email out a link to that recording to anyone who registered for this webinar, so you can review things if there's anything you missed, or you just want to be reminded.
And that means, Jen, that you can share it, right? So like if you talk to your therapist or the school nurse and they're interested, right, Jen, then they can go online and share it too. Is that right, or no?
Yeah, you should be able to, you can probably share it directly. If there's technical issues that I'm not thinking of with that, then we certainly can send out a link to somebody if you just email us and ask us to do that, because we're definitely happy for this information to get out there. I don't know if we're going to, it might also live somewhere on the website, so I'll find out about that and we can let you know. Roberta's also asking about samples of previous op-ed pieces for BFRB Awareness Week or on this topic. That is an excellent question. And if I don't have those immediately compiled, although that would be a really great thing to have. So, Roberta, if we can, then we may follow up. We now have your emails for those of you who have taken the time to register for this and be interested. So we can follow up if I'm able to organize that.
And I do encourage you all, if you haven't already, to go onto Psychology Today's website. And the format of our blog is kind of similar in terms of the length and the tone. And it's not as much making an argument, but it is sharing personal stories. So you'll see a few recent ones on the blog that's called Hands Up, Coping with BFRBs. It just might spark some ideas for you.
And that is a venue also where if you do, that's a venue that your writing can go. If for some reason either your paper doesn't pick something up that you've written, or you have a story to tell that you think doesn't quite fit, feel free to write to me. I'm Jennifer@bfrb.org about the Psychology Today blog. Okay, so Anu is asking, as doing an actual op-ed, I'm assuming we're more open, a tad more to criticism. I'm curious about that. I'm not sure if I understand the question or not, Sharene. I don't know if feel free to follow up and to clarify.
Well, yeah, if you could clarify, do you mean criticism of kind of the way things have been handled, or of the medical community? Criticism of who?
Or are you putting yourself out there so that you might get criticized for the piece that you published? Anyway, if you want to clarify your question, we'll be happy to answer it. Ellie writes, I'm a high school student struggling with trichotillomania. Is there anything I can do in my school?
Oh, we would love to see that, Ellie. So the TLC Foundation for BFRBs has put together a brochure specifically for educators, and it is free. We updated all the materials when we did the rebranding. So if you are interested in maybe getting some copies of the brochure, maybe sharing them with your principal first, or your teacher first, whoever you feel most comfortable with, we would be happy to provide copies. What you would do in that case, I would suggest, would be to email Leslie. Her email is on this slide, leslie@bfrb.org. She's the communications manager, keeper of all the materials, and it may even be, depending on where you live, we do have, providers in cities around the country. We have board members in cities around the country. So I would say initiate the conversation with Leslie, and, on a very small scale, bring in a brochure for your school nurse and principal. On a medium scale, think about whether you want to kind of distribute materials. And on a bigger scale, maybe even have a talk. And if you're not comfortable doing the talk, or not doing it by yourself, we may be able to, depending on where you're living, connect you with some experts who could come in as well. The thing about schools is it's really hard for a nonprofit organization to come in from the outside. So if you, as a student, or if one of your the faculty there are interested, then that provides a really good entry point.
Great. I would just add to that, maybe you have a school newspaper, so some of the that you've just learned today might be applicable. And also, we do have a training program specifically for speaking. So if what you wind up interested in, rather than writing, is speaking to the school, we have, for the last number of years at our conference, there's been an ambassador training program, and the task force, we have our Young Adult Action Council, is now starting to offer some of that training online. So just follow up again, Leslie, Leslie @bfrb.org. And okay, Kim asks, I live in New York City, 1 million newspapers. Is it in bad taste to send the same letter or article to several publications?
So, okay. Usually, a newspaper will say they want to review one at a time. However, so I would say, look, unless there's an absolute urgency, send it to your first pick, give them a couple of days. If they don't respond, and maybe you follow up, send it to the next one, do it sequentially. The only time I don't do that is when it's like really like urgent, it's in response to breaking news. That if it doesn't get published, that Thursday, it's never going to get published. I will sometimes send it to, maybe 3 places at once. And worst case scenario, if place A takes it and place B takes it, then you have to tell place B, you're so sorry, but you already shared it with place A. It's generally considered bad form. So I think unless it's super urgent, I would just do it sequentially and say, please let me know if you're interested. And you know what, if they don't respond within 48 hours, just move on. However, once it has been published, you can't repurpose the same piece for another outlet. You could change it, you could write something different, it could be on the same topic, but you couldn't use it verbatim and send it to the next newspaper.
And okay, so yes, so Anu has clarified. She says, yes, I'm referring to myself. Would I be more vulnerable to being criticized by correcting an author? So
Oh, Jen and I have personal experience with this. Look, no one likes to be told that they're wrong, but my perspective on this is an issue that is seriously misunderstood, right? Seriously underreported. So while we certainly don't want to cause offense and we want to always be very professional and, courteous in our dealings with the media, I do think that corrections, errors need to be corrected. So if it's a letter to the editor and you're responding to a particular piece, you can certainly convey your appreciation for the fact that this issue is covered, and just say that you just wanted to point out one error or one misperception that is kind of continued. So do it in a nice way, but I would not do it. And again, they may or may not publish it. What you don't want to do is come across as overly emotional or ranting. You want to really just like stick to the facts, try to be as factual as possible, make the correction, and be done. Jen, do you want to add anything to that?
I would just say, I think that's all really great advice. I would say sometimes you want to pick your battles. So
Yeah.
that's something that we have learned. So if a piece that you're responding to was overall pretty terrific, and there's one like minor thing, you may want to consider whether that minor thing is important enough to start a whole corrections thing about, or if what you really want to do is write and really just thank the paper for the coverage and engender a good relation, maybe even offer up your story if they want to do some future coverage, or want to do a personal piece, or offer up an angle that maybe they'd want to think about in the future. So you want to make sure if you're correcting, especially if you're sort of saying your paper has made an error, you do want to make sure that it's really an error and that it feels like important enough that it should get corrected. And if it is, then you definitely should write. But they do, as we've learned, like newspapers, they, I know there's a lot of controversy about that right now in our public discourse, but in general, our experience is newspapers really take the whole accuracy and fact-checking aspect of their work very seriously. And so if a reporter, if they're called out for an error, they take that seriously. So you do want to make sure that you're, accurate. But it's still, as Sharene said, totally worth doing if an error has been made. And I think it's a truism, Sharene, tell me if you've heard this, but basically I've always heard that if you're reading an article about something that you know very well, which of course BFRBs is for us, you almost always find something inaccurate in it, because it's being written by a reporter who's trying hard, but who's coming at it, from a place of brand new, usually research. So anyway.
Yeah, let me just add to that. So I should say that quite often when there is like a correction or a misperception to be made, I will start not with the letter to the editor. I will start with reaching out directly to the reporter or the editor and first see if they are even aware that that there's this discrepancy, and if they might want to especially these days everything's online, it's kind of easy for them to go on and make a little correction. And like Jen said, that can be the start of a conversation about, well, who are you and why are you an expert in this subject? And maybe you have stories that you might want to share if this person is interested in covering BFRBs. So it can be a relationship builder to reach out. If you can find their email, if you call the front desk, see if they'll patch you through, see if you can at least get the name of the the health editor, whoever might have edited that section. Start with a personal conversation. And I think the only time the letter to the editor correction is really necessary is if they don't respond to that, and it really is, as Jen said, a significant error. I would much rather see the letters be to build on the article and kind of talk about some additional information or resources, because that's something that people can follow through on. So Jen, we have like 4 more minutes.
Okay. So are there any other, yes, okay, one more. So be diplomatic is a news response, summarizing our statements. So it's more the words we use are key. Thank you so much. I'm interested in writing. Okay, great. So good. Well, I think that's all the questions. And obviously, you can follow up with us if anything else comes up. And like I said, we will send you out. I'm not sure if it'll be today or not, but we will get a link to this recording out to all of you so you can review if you want to. And we really do, I mean, I'm so, Sharene and I both, I know, are so thankful to all of you for being involved and wanting to be part of the momentum of really making BFRBs understood by our world. And you know, that is going to go a long way to reducing all the suffering that is caused by BFRBs, and that's TLC's mission. So I really, really thank you for helping us carry out this mission.
Yes.
Thank you, Sharene, for your wonderful expertise and your time.
Always happy to be part of it, and I really look forward to seeing some stories out there, guys. So go write.
Great. All right. Thank you all, and stay in touch with TLC. Thanks.
Thank you.